Am I live? Okay, yes, good, thank you. Welcome to the Apex High School Debate Club versus Apex High's HOSA biomedical debate. Thank you all for coming. This is the third time that these two entities have debated, and we're really excited about today's topic. Thank you for your patience with us trying to figure out this topic. It's been one that we've struggled with. Should healthcare providers be allowed to deny non-emergency care to their patients who make poor health choices? We've tried to kind of get our brain around that several times, haven't we, trying to figure out which side of the argument does this mark? The topics we've debated in the past have been a lot more straightforward. But I'm excited about this debate today and wanted to remind you all that it was Aristotle that said it is the mark of an educated mind to be able to entertain a thought without accepting it. And I think that's one of the most exciting things about debate, is that it educates our minds because we are forced to look at both sides of the argument. And entertaining those thoughts in our mind doesn't necessarily mean that we embrace them or that we accept them. But in order to have a debate, we have to understand clearly both sides of the argument. Both of these teams here have become very well versed in this topic, and I look forward to their thoughts on it today. I would like to especially thank our judges. We have Ms. Mahan, Mr. Monsell, Ms. Kurtz, and Mrs. Patelli here as and members of the Apex High faculty to be our judges. Thank you so much for being here. Without you, this would obviously not be possible. And I'd also like to thank Mrs. Shanae for being our moderator. And we are going to be scorekeepers, and we're going to get started in just a second. First of all, I'd like to invite the debate club to come forward and introduce themselves and tell us what year you are in school. Yeah, sorry.
Hello, I'm Addie Francis. I'm a senior. Me and we are co-presidents of the debate club.
I'm Winnie Dorr, senior, co-president. Hi, I'm Megan Peterson, freshman, just a member.
Thank you all for being here. And then I'd like to invite Apex High's HOSA's debate team to come forward and introduce themselves and tell us what year you are as well.
I'm Mira Leva, I'm a junior. I'm Autumn Hova, and I'm a junior. I'm Gabby Galchanova, and I'm also a junior.
And I'm Sadie Harden, and I'm a sophomore.
Thank you very much, and you all can have a seat as well. And I'm going to turn things over to our moderator, Mrs. Shanae.
Okay, we're first going to hear from the affirmative constructive speech, which is HOSA. So, you know what I want to say? HOSA? It's HOSA.
Health Occupational Students of America, sorry.
Health Occupation Students of America. So they're going to come up and begin the speech. They are the affirmative constructive section. They are the affirmative side.
Just 2 weeks ago, my friend's brother Jim went to the dentist for a general checkup of his teeth. After a close examination, the dentist determined that Jim needed braces, but he noticed that Jim had not been taking care of his teeth. Since braces increase the chance of cavities and gum disease if proper oral hygiene is not maintained, the dentist asked Jim to first get into the habit of flossing and brushing his teeth before he could receive braces, in order to have the most sustainable orthodontic treatment. Is it justified for the dentist to deny Jim orthodontic treatment if Jim's lack of following hygienic requirements would in the end lead to a failed overall orthodontic treatment? Because we believe the outcome is what matters, Health Occupation Students of America resolve that physicians should be able to deny patients non-emergency care if the patients themselves are making poor health choices. According to Webmaster Medical Doctors, among all the patients treated with anesthesia at the University of Michigan between 2001 and 2005, 6,773 patients experienced post-operation complications. Out of these patients, about 33% were obese and 15% were morbidly obese. In In other words, since obese patients have a higher risk of complications following surgery, we feel from a medical standpoint that morals can be based off of logical reasoning and not just what is ethically correct in determining care. This does not mean that physicians should deny all obese patients care, but that they should analyze each case and determine whether the obesity is caused by a poor lifestyle choice or simply issues beyond the patient's control. We believe that the doctor is doing more harm by treating a patient that has chances of a higher mortality rate after treatment than if they were to deny the patient the treatment itself. Some poor health choices could include smoking, obesity, drugs, and in some cases alcohol. Other non-emergency treatments that should be rationed by doctors when giving care could include in vitro fertilization, cosmetic surgery, and general physical exams. In fact, a study done at the University Medical Center in Nijmegen, Netherlands, proved that the risk of failure for in vitro fertilization increases by 50% for smokers. The modern Hippocratic Oath states, and I quote, "I will apply for the benefit of the sick all measures that are required, avoiding those twin traps of overtreatment and therapeutic nihilism," end quote. However, it would be more harmful to perform the procedure because the patient's risk factor, such as lifestyle choices, could negatively affect the outcome of the procedure, which would be doing harm and not for the betterment of the sick. My opponents, those opposed to denying patients non-emergency care, will most likely mention that resources in healthcare should be equally distributed among all patients in need. However, we believe that in a resource-constrained environment of today, a patient making good health choices may be prioritized over a patient making poor health choices in order to give the latter an incentive to improving their lifestyle. Physicians should have the ability to properly allocate resources to patients. Apex High School HOSA believes it is ethical, legal, and logical for a physician to abnegate treatment to a patient making unhealthy lifestyle choices if it is for the patient's benefit in the end. Thank you.
Members of the debate club will now represent the negative and cross-examine.
Is it true that patients cannot be refused urgent medical treatment? Is it true that early detection is often key to preventing many life-threatening emergencies? Could regular preventative checkups detect these potential life-threatening emergencies? By this logic, couldn't refusal of non-urgent preventative medical care lead to life-threatening emergencies? But couldn't refusal of non-urgent preventative medical care be life-threatening?
Yes.
Okay. Is the right to health and well-being a universal one?
Yes.
Are doctors propagators of this right?
Yes.
All right, the debate club will now represent the negative constructive speech.
First of all, I'd like to thank everyone for being here, for taking time out of your busy schedule, students and faculty alike. So let's begin. The right to well-being and health is a universal one. It's included in the Declaration of Independence. It's also included in the UN Declaration of Human Rights. But beyond those documents, it's a fundamental right that's been ingrained in the moral fiber of America since its inception. The basic right to well-being isn't refused to one group of people and extended to another. Refusing medical treatment to patients, regardless of their lifestyle, is a direct perversion of humanitarian need. When we see doctors, we shouldn't view them as judges carrying out a sentence, rather as caretakers, leading us to the healthiest directions. Doctors should not be able to refuse non-urgent medical care to patients that make poor health choices. As HOSA dignified poor health choice as smoking, obesity, drugs, and alcohol, but what about a parent who doesn't want their child to get vaccinated? Should they be refused regular pediatric care? Should a football player who's more likely to receive a head injury be received medical evaluation? But taking into account smoking, obesity, and other addictions, these unhealthy lifestyles that HOSA mentioned, they're often a byproduct of a disorder or a stressful life. A blanket ban on poor health choices leaves a cynical note hanging in the faces of patients that fall under this discrimination. Doctors should obviously be able to offer clinical advice for the patient's well-being if, as they mentioned, it results in their health, but outright refusing them treatment as a derivative of social stigma is the same kind of opposition we as Americans fight constantly. More than anyone, however, lower-income families would be affected by HOSA's resolution. According to a health study on poor choices and socioeconomic status, the sad truth is families with low socioeconomic status are more likely to partake in tobacco products, be obese, and generally have more health problems. For these families, however, it's not an unhealthy lifestyle, it's just a lifestyle. A harsh one that's hard to leave, seeing as, according to Pew Research Center, low-income families' median income has declined 45% since 2005, further inhibiting vertical socioeconomic progress. Afflictions such as obesity and alcoholism just can't be turned off or ignored, especially in these low-income areas and, as HOSA said, resource-constrained environments where eating unhealthier foods is cost-effective and alcohol and other drugs are coping mechanisms. Of course, yes, Medicaid and welfare programs do provide free health care for some. 23 states under the Affordable Care Act have not expanded medical program coverage, leaving large coverage gaps of uninsured Americans. Where do these families, also refused by medical practitioners, turn to? It's important to consider that 25% of the taxpayers' dollar goes towards health services in the United States, according to whitehouse.gov. This includes Medicare, Medicaid, and other public health services. So the taxpayer foots the bill for this medical treatments, yet is expected to forego the same benefits they pay for. These patients with poor health are more susceptible to life-threatening diseases with lack of treatment. Early detection is key in treating many of these diseases, which is impossible when doctors neglect these patients by refusing them treatment. After prolonged neglectance, what could have been a simple preventative checkup turns into an emergency medical procedure with the patient's life at danger. This snowball effect outlines the potential consequences of a doctor's refusal of treatment for patients making poor health choices. Patients cannot be viewed as liabilities and be deprived of their natural right of well-being. Not only is medical refusal immoral and discriminatory, it inhibits the lives of low-income families and can potentially snowball into medical emergency treatment for these already unhealthy patients. The right to well-being isn't a trivial one, so let's not treat it as such.